name is Shelniel Bostic and I am a registered massage therapist, and welcome to Healing Hands. On this episode we are going to be covering the areas of the upper arm and shoulder joint. Within that area we're going to be covering the massage aspects, a little bit of joint play, a bit of stretching for that region. So let's get to it. Alright, we are going to cover from the upper arm to the shoulder joint. So in this process, I'm going to just briefly mention, I've already gone through in a previous episode for the hand, a small touch of a recap on the forearm to the elbow in this concurrent episode, and then since I've already worked through that region, I'm just going to go into the upper arm. The lotion, I've already placed some on his arm because my palpation doesn't need the lotion. It just gives me a chance to find what is, play hide and seek and find what needs to be worked on when I work on it. And we're just going to make one little side note. Part of the reason for the lotion is depending upon the person in question, if they have a fair amount of body hair, the oil or the lotion usually gets absorbed into the hair, or if their skin is super dry, it also absorbs the oil that much quicker. So it's just a matter of finding out how much you need at the time that you need it and work with it. Depending on the type of work one of the client who's on your table is doing, either they will have, or at least you may notice that the anterior portion to the middle portion of the deltoids can be super tight, or the posterior can be, depending again what they do in their jobs. So here I'm just spending a bit more time because this lovely gent is also a courier and has been for a while, so obviously the anterior portion of his arms, and especially the deltoids to the middle, is going to be super tight on him. And that extra color is a good thing because there's more circulation being brought to the muscles and tendons and connective tissues and all that fun, wonderful stuff. Circulation's a good thing. Lack of it's not a good thing. I don't always do a fair bit of stretching in this region, but I find that this does help with the biceps and giving a little more range back to that muscle, especially when it is tight. literally, I am bouncing over the attachment site to the deltoids, and his is, well, hypertonic, to put it mildly. That is going to be that for this region so far. Just realized I hadn't commented on one little factor. As you notice how my hand is, it is not grabbing across the arm because I really don't desire to set off my client's anxiety. And I keep my hands literally open on purpose so that it doesn't feel compressive across the wrist or anywhere else. It's still open, regardless when I switch hands. This way, it's just much more calming and less aggressive. It's not the word I really truly want, but it will work.
You're not, it doesn't feel like he's handcuffed. It's more like you're just holding him, not restraining him.
Correct. That's a great way of explaining it. Thank you.
I write stuff. I'm good with words.
Uh-huh. All right. Things are loosening up much better. In some areas, still need a bit more time and attention. And I'm not putting a lot of pressure in this region, but just enough to get the tissue to move, because there's enough arteries, veins, and nerves that run through this area that I really don't desire to create altered sensations going down the rest of his arm. This might look like the focus is strongly on both sides, but it's actually more weighted on the lateral side than the medial side. But then again, at the same time, the muscles on the lateral side will be more tighter than the medial side because they don't get worked out as much. hadn't mentioned is I'm still controlling where his arm is and where his hand will lay. So there's very little pressure that I'm using, but just enough to keep the shape and the frame that I have without it landing across his neck, which is not usually comfortable. So I am very mindful of where I've placed his arm. Playing with the ankles so that I can find the best way to release the muscle. But I'm also wanting to put it in as short of a position as I possibly can to release it more gently than just stretching away on a tight muscle, which would help. However, if you're poking a stretched muscle, you also be making the client feel a little more uncomfortable. That's why I like to put it in a short position if I can to release the muscle. Oh, that's better. All right, that is about that for this region. One more lovely little traction of the arm, gently. As you notice, I like doing it in both directions. And put the arm away. This maneuver may look unusual and maybe seem to look like it's uncomfortable, but it actually isn't. I'm not going to the point of creating pain and discomfort with this, which does very much look like a snake bite, but it isn't. It's just an indirect kneading and lengthening some of the muscles in the process. Is that. Thank you for watching this episode with Healing Hands. The area that we covered today was on the upper arm and shoulder joint. Have yourself a great day, and I shall